Hi there, welcome to Bert's Travels. We're back, and today we're going to talk a little bit about, well, global healthcare. And that's a topic that I guess can mean a lot of different things to different people. First, I'll start off by saying we're not insurance agents, we're not financial advisors, we're not compensated in any way by any of the insurance companies that we're naming in this video, but we'll tell you about our experience and what we're doing and why we're doing what we're doing. And maybe that'll help you in your consideration of insurance or lack thereof if you decide not to have it, depending on what you're doing. So, welcome to Bert's Travels. I'm Bert, and this is my personal travel agent, Sanya.
Yeah, we retired early and sold everything to slow travel full time.
And by slow travel, we mean we're typically staying anywhere from 1 to 3 months in a particular location.
Mhm.
So, insurance. Um, our situation is that we are traveling a lot worldwide, but we're also coming back to the United States. And that's pretty much something I need to really think about a lot when we're returning to the States. I want to have some kind of coverage, at least for me and Sanya, while we're here. That's where
Right,
the expenses are crazy.
right. And we're visiting at least 2 or 3 times a year, but it could be more. And it really depends on what's going on with our kids. They're kind of at the ages where anything could be going on. We have a 21-year-old, a 24-year-old, and a 30-year-old. And honestly, somebody could be pregnant and having a baby, or somebody could be in the hospital with a burst appendix. Either way, we're coming. We're
Yeah.
gonna be in the United States. So um, because of that, that's why we really felt that we needed to have coverage while we're here.
And one of the companies that offers that kind of coverage is Cigna Global. And that's what I've got right now for the both of us. We've got a silver plan that's very basic, really. It's got up to $1 million coverage per year.
Mm-hmm.
We can spend 180 days a year in the States and still maintain that coverage, which with many other policies you can't.
Mm-hmm.
So currently, we are carrying a Cigna Global Health coverage that covers us just about anywhere in the world,
Mm-hmm.
with up to $1 million worth of medical coverage.
Mm-hmm.
It's a silver plan on the lower scale of what they offer. It doesn't have all the bells and whistles.
Which means a high deductible.
Mm-hmm. And for the two of us, the cost is about $422 a month,
Mm-hmm.
which is fairly reasonable considering that we do need some coverage here in the States.
Right. And those numbers will be different for you
Mm-hmm.
or whoever plugs them in. It depends on your health uh, circumstances.
Whatever
And
pre-existing conditions you might have. Yeah.
mhm, mhm.
Um, and I think it also depends a lot on where you originally have the policy written, in what country you start your coverage.
Mhm.
Uh, for us, that happened to be, we started in Italy.
Mhm.
So prior to that, for just straight outside of the US coverage, we had Safety Wing,
Right.
um, which was reasonable. I can't say that we've used any of this insurance,
No,
fortunately.
no. I don't think
Um,
we'll have to.
hopefully, we don't.
My understanding is we'll, outside of the United States, we'll probably never meet the deductible.
Yeah. It's more of a catastrophic coverage for us if
Mhm.
we happen to be in the United States and something happens here, because a trip to the emergency room can change things real fast for your
Right.
finances.
If he were to have a heart attack or if I had a stroke or whatever in the United States, I think we'd be bankrupted.
Yeah.
And for us, we're not willing to take that risk right now.
No.
The other thing that nobody wants to talk about is the big C.
Yeah. Cancer.
And it's just something I worry about. It's definitely something that's in my family. I know you have a little in your
Hmm.
family. And we don't want to be bankrupted.
Yeah. I want to be able, if one of us has a problem, to be able to continue this kind of lifestyle without much of a financial impact.
Mm-hmm.
In lots of cases, for people that aren't necessarily coming back to the US, it makes more sense for them to maybe have no coverage at all and just pay out of pocket
Yeah.
for medical expenses. And I
Mm-hmm.
think in a lot of the countries we've been in, we've seen the fact that medical expenses can be fairly low
Right.
and you don't have much to worry about or need to invest in insurance if you're of reasonable health.
Right. And he has high blood pressure
Mm-hmm.
and has been able to get his medication. He got it in Panama and in France,
Mm-hmm.
both for
For
less than what the deductible at home
yeah,
was.
the copay
So,
was more here than
right,
anything else
right.
in the rest of the
And
world.
it just wasn't hard to get at
No,
all. Just go in a pharmacy, bring your bottle, and
ask for it by name.
mm-hmm.
Yeah. For your shorter term travel, maybe Safety Wing might be a more affordable option for you. It was for us when we first started out and we wanted coverage just in Central America.
Mm-hmm.
It was reasonable. And the only problem that I saw with Safety Wing is that if you happen to be above the age of 69, they're not going to cover you.
Right.
They won't carry anybody that's older than that.
We're not there yet.
No, not yet. um, People have said that I know that it's been easy for some folks. I've heard other YouTubers say that Safety Wing can be a little bit of a harder thing to get reimbursed for if you have expenses.
Mm-hmm.
Fortunately, again, I can't say for sure because I haven't had the opportunity, and I'm glad I haven't had the opportunity to find out.
If the opportunity arises, we will share that with you
Yeah.
because we want to share everything with you on our channel. We want you to be able to use our channel to help educate yourself uh, in your own travels.
And so, anyway, that's how we are covering medical catastrophic situations
Right.
that could occur.
Were there other insurance plans that you looked into, companies?
I looked at GeoBlue,
Mm-hmm.
also had similar types of coverage like Cigna Global,
Mm-hmm.
and you could upgrade Cigna Global
Mm-hmm.
to cover all kinds of things like dental or
Mm-hmm.
telehealth if you wanted
Mm-hmm.
those things. Also, I think even like they offered some psychological services,
Mm-hmm.
and there was a whole array of things that you could get from Cigna Global.
Right.
And
And you could upgrade those probably at any time.
sure, if you
Yeah.
wanted to.
Mm-hmm.
The quote process was fairly simple. I got online, I emailed back and forth with an agent,
Mm-hmm.
and they wrote a policy after having a few. We filled out a medical questionnaire for both of us, um,
Mm-hmm.
and boom, you got a policy.
Yeah.
And it's a good feeling to know that I've got something.
Yeah. And one thing we are going to be looking into is ACA, the Affordable Care Act. Uh, we just need more time to really dig deep into that to figure out income limits, how we qualify.
That may be something that we would
If
carry for the United
right,
States. Obviously, wouldn't work anywhere else.
right.
Um, but if that turns out to be less than the additional costs of the 180-day policy upgrade to cover your time here in the States, that's probably the way to go.
Yeah.
Yeah.
Yeah. We think that that's probably the best way to go, but we're still new at this and this is where we're at right now. And again, we just wanted to share that with you and where we're at. So
it certainly is a big chunk of our expenses every month.
it is.
It's something to consider if you're traveling all the time. But it's also nice to know that you've got some kind of coverage to help you out should you get into a situation and need it.
Yeah. And by the way, I brought up cancer and I'm bringing it up again. um, we know that we can be treated for cancer in other countries. And we know that in many other countries, the care is probably just as good or close to what we would get in the United States. And, that's all going to depend on what kind of cancer you have.
Yeah, but it's also good to know that if you did have that and you wanted to come back to the States, you could be treated for
The
at least
option
for
is
six
there.
months anyway.
Right.
Yeah.
The option is there. And there's something to be said about being with family during a time like that.
Hmm.
So,
Yeah, I think it'd be really difficult to come down with a illness or something really catastrophic or terminal and not be able to come home and be with family during that time, which
yeah,
is probably more important than whatever you're going to spend on insurance.
probably the most important thing to me. Yeah.
Yeah.
And on that somber note,
Sorry, this wasn't
sorry,
uplifting.
what a drag.
No.
Thanks for joining us. If you find our information helpful in any way, please subscribe to our channel. It helps us get more information out to you.
What are you doing for insurance?
Yeah, let
Let
us
us know.
know.
Yeah.
Let us know. And if you're not doing it, that's great too. But just let us know. We're interested. And like and subscribe.
Thanks.
Ciao.
Ciao.